Marin County health officials echoing other Bay Area health departments when it comes to COVID-19 infections, saying being vaccinated is the best way to prevent a severe illness.
The county says it's had almost 200 breakthrough cases. That's out of more than 12,000 total cases. Breakthrough cases are those infections that occur after a person has already been vaccinated. Of the breakthrough cases, just 4 people have been hospitalized. None of them are in ICU and none of them have died.
By comparison, 185 people not vaccinated have died because of the virus in Marin County. And for more now on this, KRON 4's Teresa Stasio is live for us in Marin County with a new message from health officials. This has public health officials. They're sounding the alarm. And Teresa, they're saying that the issue here is that children are not vaccinated and they are among the most vulnerable.
Without a doubt, Justine and Ken, and that's kind of the bottom line. As you were mentioning, those 4 cases, those were hospitalized, and that's the bad news. We're having those breakthrough cases. The good news is that the vaccines are holding strong. But again, we have so many people who are vulnerable, so many people that cannot get vaccinated, including children. And so very much this pandemic is certainly not over.
We're seeing it's breaking through more frequently.
Dr. Matt Willis, Marin County's public health officer, talking about new information coming in on rising COVID-19 cases and how vaccinated people are testing positive.
Breakthrough cases are much fewer than cases among unvaccinated people at a ratio of about 4 to 1, more unvaccinated than vaccinated. But it's obviously discouraging to see anyone who's been fully vaccinated to become infected with COVID-19. That's really because of the Delta variant.
Dr. Willis says, fortunately, the vaccines continue to protect people against the worst aspects of COVID. No one vaccinated in Marin County has died of COVID-19, yet there is growing concern about children with this variant.
That's one of the concerns, and one of the reasons that we made the recommendation that we all cover our faces indoors, regardless of vaccination status, is that we all need to do our part to protect those people who cannot be vaccinated, our youngest residents, under age 12, no choice to be vaccinated. It's not authorized for children in those age groups, and they are more vulnerable to infection because they're more unvaccinated, and so obviously the Delta variant being more contagious, we are seeing more cases among children now than we had seen before. And so those of us that are vaccinated can do our part by covering our faces, and of course adults who are the choice to be vaccinated, even more reason why it's time to step forward.
He adds, with summer travel, important to remember the guidelines pre-vaccines hold true today.
You look at the CDC guidance and Department of Public Health, California guidance, as well as in Marin, for unvaccinated individuals, the travel quarantine guidance hasn't changed. We are still requiring that people who travel outside of the region and come back here, if they're unvaccinated, they need to quarantine.
Quarantine for those 10 days, right? And then if you don't do that, then you have to be at home for 5 days, then get tested, and then resume your normal activities, be it going to summer camps for those kids, or if you have a compromised situation where you can't get vaccine. For example, if you're undergoing chemotherapy or something along those lines, then you also need to make sure that you follow the guidelines set up by the CDC as well as the state. So again, that's what's really important. That's a message that they want us to get out to everyone, because the bottom line, this pandemic is certainly not over. Reporting live here in Marin County, Teresa Stasio, back to you guys.